Here is a diagram of the lung. We have the right lung with 3 lobes. We have the left lung with 2. The trachea is here and it splits off into 2 bronchi, the left and the right side, and they break off further into bronchioles, which is this right here. This is the inner muscle layer and the smooth muscle layer, and the mucosal area. After the bronchioles extends into the alveoli. This is this diagram here, and this is where gas exchange occurs. The diaphragm here is a muscle that is one of the major muscles that helps with breathing. And this thin line here will be our um, inner and external muscle layer. Breathing is the management of air pressure and gas exchange that starts by taking in outside air through the nose. Breathing involves 2 main steps. The first is inhalation or inspiration of oxygen and other gases. When a person breathes air in, the diaphragm contracts, pulling down, and the external intercostal muscles also contract, allowing the chest to lift and expand. This creates space, allowing the lung to fill due to the increase of volume and decrease in pressure. The second step is called exhalation or expiration. This occurs when the diaphragm relaxes, an upward motion. The external intercostal muscles relax, so they go back in, and the internal intercostal muscles contract. They're also pulling in toward the lung, causing the chest cavity to fall. This creates an increase in pressure and a decrease in volume, causing the squeezing effect of CO2 out of the lungs through the trachea and out of the body. Here is a diagram, physical one here, of a lung. We have the diaphragm here, represented by this balloon, 2 balloons on the inside representing the lung. These metal straws here are the bronchi, and of course the outer shell is the chest and the chest lining. So in order for breathing to take place, this is the mechanism of action as far as the operation of the lungs go. So if we're going to contract the diaphragm, it fills the lung, and when you relax the diaphragm, it deflates it. And this is how that works. I don't know if you can see really well. There's air coming out of the bronchioles, which is actually CO2. Some people have a larger lung capacity due to the actual size of the lung, a larger chest cavity, and a stronger diaphragm muscle. Now, asthma is an inflammatory disease affecting the bronchi and the bronchioles. People with asthma have chronically inflamed mucosa and the smooth muscle lining. An asthma attack can be precipitated due to a hyperresponse of smoke, stress, allergens and pollutants, etc., that trigger the release of histamine. The bronchi and bronchioles already have swelling from this disease. So with an asthma attack, this increases and an overproduction of mucus occurs. This sticky substance further narrows the airway, compromising adequate air in and out of the lungs. Nursing priorities for a patient with asthma exacerbation should include the nurse sitting the patient up in a high phalanx position and give oxygen as soon as possible. Also, do a quick assessment of the ABCs to correct hypoxia, improve ventilation, and monitor respiratory status with heart rate and oxygen. The fourth step involves starting short-acting bronchodilators and anti-inflammatory medications like corticosteroids, albuterol, ibuprofen. Those medications help to expand these bronchial areas so that air can move freely through them. Finally, the nurse must reassess the patient, get a chest x-ray, and continue to monitor vital signs. It also may be necessary to call the respiratory department if they are needed. Main teaching points that a nurse should give a patient with asthma includes understanding and learning their triggers. This is being mindful of their environment, stress and anxiety. It also, they should have their rescue inhaler close by. And monitoring the signs and symptoms of asthma exacerbation while at home, and what are the proper steps due to help control those issues. It will also behoove the nurse to encourage a teach back method with how to use the patient's personal inhalers, because there's so many different kind. And also, if a patient exercises and they have, say, exercise induced asthma or things like that, learning or teaching them how to do the pursed lip breathing method when shortness of breath occurs. Now, here in Prescott, Arizona, most of the community resources for asthma is provided by the state and state services. So there's a Arizona Asthma Coalition here. There are also smoking cessation programs, which also helps with people that have asthma. And of course, care and management of the local medical community. They always provide a plethora of information to asthmatics and give new and up-to-date evidence-based practice methods on what to do to decrease problems with asthma.